Hi everyone, I'm Mariam from Cheering. Today I'm going to talk to you about infant feeding in emergency situations, especially in the case of the COVID-19 pandemic. First of all, what is coronavirus? Well, coronavirus is a type of germ that causes a disease called COVID-19. The disease has spread all over the world, it infects lungs and can cause breathing problems. How can you catch the disease? Well, germs like coronavirus attack our bodies from the inside. If another person sneezes or coughs, you can breathe in the germs and get sick. This can happen even if someone does not look sick. How can you feed your baby with COVID-19? The World Health Organization says women should breastfeed even if they have the virus. This is because breastfeeding protects babies from viruses and illnesses. Breastfeeding with the virus is safer than not breastfeeding at all. Up until now, we know that some babies have caught COVID-19, but we're not sure how. But don't worry, most babies and young children who catch COVID-19 get better very quickly and do not get very sick. You should always make sure to protect your baby and keep breastfeeding them. Don't cough on the baby, try to cover your face when you're nearby. When sickness is in the air, the mother's body makes special cells that go to work to fight against the sickness. These special cells go into the milk, and when the baby drinks the milk, it protects the baby from sickness. Breast milk is always clean, healthy, and ready. If you do not breastfeed and must bottle feed instead, be careful. Use the correct amount of formula, do not give animal milk to babies under 6 months, use boiled, clean water, and sterilize the bottles. Keep the bottled milk in the fridge and do not reuse the bottled milk when the baby has already drunk from it. It is much safer to breastfeed. If everybody breastfeed, 800,000 babies' lives would be saved each year. Infant diarrhea would be cut in half and breathing problems would decrease by 1/3. But will you make enough milk? If your breasts are developed normally, you will make enough milk. Breastfeed from day one and you will have enough. You do not need a special diet for it. Your milk will be perfect no matter where you are living. If you breastfeed, your baby should poop and pee often, while gaining weight. If they do not, you should contact a doctor. How big is the baby's stomach? On the first day, it is the size of a cherry. On the second day, it is the size of a walnut. By week 1, it becomes the size of an apricot. On the first month, it becomes the size of an egg. What happens when you want to stop bottle feeding and breastfeed instead? Well, the success depends on many things. You can try by slowly trying to cut some of the bottled milk every day and try to breastfeed to make up for it. The more breast milk a baby drinks, the more milk you will make. So the baby must drink as much as possible. If you want to make the switch, you must monitor your baby's growth and make sure that you are making enough milk. In emergency, or not, try to feed only breast milk for the first 6 months. Then you can introduce solids, but keep breastfeeding.